Research presentation, English 1530, Crystal Caswell. Non-medical use of prescription medications such as narcotics, stimulants, or depressants is a huge epidemic in the United States. It affects all 50 states. While some states have more opioid prescriptions per person than others. With this chart of the United States, you can see all the different states in different colors. The yellow colors are 52 to 71 prescriptions per 100 people. The orange are 72 to 82 prescriptions per 100 people. The purple, with the dark purple lines going through it, is 82 to 95 prescriptions per 100 people. And then the dark purple are the worst states with 96 to 143 prescriptions per 100 people. Most of the dark purple states are east of the Mississippi River. New York falls into about 50 to 70 prescriptions per 100 people, which is on the lower end of this chart. As you can see, prescription abuse is a nationwide problem from coast to coast. With this epidemic, we need to make sure patients being prescribed opioids have all possible side effect information, along with better access to programs to help those who have become dependent, and stricter guidelines for doctors who have written these prescription opioids. While most people follow the prescription dosage as ordered by their doctor, some do not. With this chart, abuse of prescription drugs affects young adults most. Young adults ages 18 to 25 are the biggest abusers of prescription opioid pain relievers, ADHD stimulants, and anti-anxiety drugs. They do it for all kinds of reasons. Because they think that the RX stimulants will help them study better, or they just want to get high. But RX abuse is dangerous. In 2014, more than 1,700 young adults died from prescription drugs. The past year's abuse. In 2014, the non-medical use of the prescription drug was highest among young adults. From ages 12 to 17 was about 6%. 18 to 25 was about 12%. And 26 and older was about 5%. As we discussed a few seconds ago, the motivations for use were just so that they could think they could help study better or just to get high. But some other uses are experiment, relax, help with pain relief, deal with problems, lose weight, feel better. Some even take it to help them sleep. Drugs approved by the Food and Drug Administration for sale in the United States must be safe, which means the benefit of the drug must outweigh the risk of the drug. Opioids are considered a Schedule II substance. Any drug in this class is considered a high likelihood for misuse or abuse. Side effects can happen to anyone taking any type of medication. Most common side effects are dry mouth, nausea, dizziness, drowsiness. The more severe side effects are hospitalization, disability, some even have death. If you experience even the smallest of a side effect, you need to talk to your doctor as soon as you can. The road to drug addiction begins with a voluntary act of taking a drug, but over time that decision is no longer voluntary. As your body gets used to the drug, it then craves it. Because drug addiction is a chronic disease, people can't just stop taking the drug for a few days and be fine. This is where inpatient or outpatient programs come into play. Inpatient programs can either be long stays, anywhere from 6 to 12 months, or short stays, a few weeks to a couple months. Most addicts, though, choose not to get help because treatment can be very, very expensive. This chart, this shows us that the typical cost of treatment is anywhere from $15,000 to $27,000. The breakdown in options are intervention, service, supervised medical detox, partial hospitalization, inpatient care in a facility, intensive outpatient care, or sober living. These can range anywhere from $250 today to $2,500 a month. There are about 14,500 specialized drug treatment facilities in the United States. Some of their offerings include counseling, therapy, case management, addictions, medications, and other services. Providers that are available at these counseling treatment centers are counselors, physicians, nurses, psychologists, and social workers. While there are guidelines for doctors who write prescription narcotics, we need to have stricter ones put in place. Right now, a prescription for a controlled substance must have the patient's full name and address, the doctor's full name and address, and the doctor's DEA registration number, along with the drug name, the strength, the dosage form, quantity prescribed, and the directions for use, along with the number of refills if there are any. Refills on Schedule II narcotics are not allowed by federal law, so the prescribing physician must order a new prescription every month for the patient. While there are guidelines in place right now, physicians write in prescription narcotics. The CDC guideline for prescribing opioids for chronic pain, United States 2016, says, it offers a framework for primary care physicians treating patients for chronic pain. This is defined by health officials as pain that lasts more than 3 months or does not dissipate after the amount of time the injury or illness typically resolves in people. More than half of all opioid uses in the United States are prescribed by primary care physicians in outpatient settings, which means your doctor's office. And federal health officials believe more guidance is needed in this area of medicine. With all the evidence surrounding prescription abuse, we as a nation need to work together to help bring this epidemic to an end. We need better information given to patients about their prescriptions, more affordable treatment programs to help those who have become dependent, and stricter guidelines for the doctors writing the prescriptions. My works cited with all my sources are IMS, National Prescription Audit, American Addiction Centers, and the CDC government, or cdc.gov.